the sensory system encompasses like seeing, hearing, smelling, touching, tasting. We don't go over all of those. We mostly just do eye and ear. So hearing and seeing, tasting isn't, you know, smelling, tasting, touch. There's not really, we don't really talk about those super much in this disease class. So I made 2 different PowerPoints, one for the eye and one for the ear, just to kind of break it up a little bit, even though it's in the same chapter, just to make it a little bit more bite size, so you can like focus on just the eye, and then focus on just the ear, just to make it a little bit easier. All right, so there are different eye stuff, but don't get, you know, overwhelmed. Most of it is pretty easy, not very complicated things. Here's just a little diagram of what the eye looks like. There's also a little video I sent for homework that will kind of like go over a little bit about the eye, not anything crazy in depth, but just to help you understand, like, because some of the diseases you have to know some of the structures of the eye to understand what's happening. All right, scroll through that. All right, so I wanted to start with some different diagnostic tests, just so you're familiar with those. You don't need to know a ton in depth how they work, but just so that you know, like, when someone talks about an ophthalmoscope, that you know that it's for an eye, right? So ophthalmoscope is, you know, that thing the doctors look in your eye with, right? They can see the back of your pupil, the back of your retina, just to inspect the structures of the eye. They typically, you know, they do that almost in every like pediatrician visit, you know, to check the back of the eyes. So that's ophthalmoscopy, or an ophthalmoscope is the name of the tool. Then there's, you know, you've probably seen this, you know, that chart with the letters on it to check your vision. That's called the Snellen chart. And they do, you know, you get a number out of 20 to get your, you know, your vision score. So 20 out of 20 is 20/20 vision is perfect. And as the number on the bottom changes, that tells you like what your vision score is. So the first number 20 doesn't change, but the smaller the bottom number is, the better your vision is. And then 20 out of 200 is considered legally blind. All right, another diagnostic check. They can do something called an extraocular muscle function test. You actually have muscles on your eyeballs. That's what make you able to look in different directions, right? So like the different muscles work to help you look upright, left, down, all these different things. So if someone's having eye issues, they'll, you know, have you do the, you know, just a test to see if they can follow the finger in every direction, and sometimes people have a hard time looking in one direction or the other. So that's just a way of testing the nerves 3, 4, and 6, which are responsible for those muscles. And then I forgot to mention in the vision test, what they're assessing actually is cranial nerve 2, which is the optic nerve, which is the nerve that actually goes into your eyeball and allows you to see. And then let's see. Then we have something called tonometry. This tool itself is called a tonometer. Basically, what this is kind of like a blood pressure cuff for your eyeball. You know, like they put the blood pressure cuff around your arm and they take your blood pressure. This is kind of like that. That tests intraocular pressure. So intra meaning inside, ocular meaning eye. So what they do is they like puff a little bit of air on your eyeball, and then they kind of measure how the wall of the eye flexes in response to that pressure. And it basically just tells you how much pressure is inside the eye. And that matters because too much pressure inside the eye can lead to blindness, just like too much pressure in your vessels can lead to like problems like aneurysms and things like that. So let's see. Then we have what's called a slit lamp. A slit lamp is just where they shine a very bright light in kind of a thin line, a slit, to like really look in depth at surfaces of the eye. They can see, you never get those, anybody have those little floaters in their eye? Like you look, and like if you look at the sky, you see these like little floaty things, they're kind of annoying. They can identify those, they can look at just abnormalities in the back of the eye, so it's just more of an in-depth ophthalmoscope kind of. It's more like more intense visual inspection. And then this one's fun. This one is corneal staining. This dye they use, they can drop it on the eye, like kind of like an eye drop, and the dye will stain if there's a corneal scratch. So you can see this is, I think this is a dog, but whatever, they can use it on dogs too. You can see right here there's like a scratch on the eyeball, right? So the cornea has been scratched, so the dye will stick anywhere that there's an abrasion, so they can identify where a scratch may be. And that dye is called fluorescein, so that way they can just locate the injury. And also too, if you have like something stuck in the eye, like a piece of dirt or a piece of glass that you might not be able to find, the fluorescein will stick to that as well, make it easier to find and remove. Then we have fluorescein angiography. So same idea, you have that dye, but instead of just dropping it on the surface of the eye, they actually inject it inside, like into the bloodstream, so that you can actually see the dye, like identify where the blood vessels are. So like since the dye is going through the bloodstream, like the blood vessels become visible. So this is actually the back of the eye, so you can actually see where all the blood vessels are. And this is helpful if like someone had a ruptured blood vessel in the back of the eye, they could see that. They can see the pathway. If there's a clot or a blockage somewhere, that's what that's used for, to see that. Does that make sense? Any questions on that? All right, any questions on any of the diagnostics? I just wanted to kind of make special slides for those so you can be familiar with what they are. All right. Now, we're going to talk about refractive errors. Refractive errors just means that there's something wrong with the lens. The lens is the part of the eye that, you know, like people have lenses on their glasses. This is kind of the same thing. You actually have a lens in your eye, and if that's shaped incorrectly, it can cause farsightedness, nearsightedness. You've probably heard of these, astigmatism. So the first one, hyperopia. This is what we call farsightedness. So just the difficulty seeing things nearby. Like you can see things far away, but you can't see things very up close. So that's when people kind of like hold the newspaper out like this to read better. And then we have the opposite, myopia. That's nearsightedness. So they have a difficult time like reading like street signs far away or what have you. And then astigmatism. This one's just more blurry, especially like when they drive at night. A lot of like the light shining through the windshield appear blurry. It makes it difficult. And then presbyopia. This is actually the same as this, but it's just due to age. So like when people get old, their lens starts to lose elasticity. So they have the inability to focus on near objects. That's typically why you see older people, when they're sitting down trying to read something, hold it far away from them. So it's the same thing as the hyperopia, except this is just due to age, if that makes sense. You can kind of tell if you have one of these, like if you have eye issues, if your eyes hurt after like you straining them for a while, if your eyes, you feel like you're squinting a lot to try and read, if you get headaches, those are all like typical signs that someone might need glasses, right? So that's basically what we do to treat it, is you give them glasses, contacts. You can do LASIK surgery. Anybody had LASIK surgery? My husband had it. He had really, really bad myopia. Like really, really bad. His vision was not quite, 2200, because that would be legally blind, but it was not good. His glasses he wore were like this thick. When he was, pictures of him when he was younger are really funny. But yeah, after he got LASIK, his vision is like better than perfect now. Basically what they do.
One thing is after that surgery, I can see far away, but then with time, about 4 or 5 years later, I can't see nothing close now.
No? Well.
Yeah.
Well, this might be some presbyopia forming. Oh, okay. All right, then we have nystagmus. Nystagmus, basically, I don't know if anybody's ever experienced this. I've had this a couple times when I'm like really tired, or like I've stayed up too late, like looking at screens or trying to read. Your eyeballs actually like start twitching, kind of. I don't know if you've ever seen that. Like your eyeballs will like start like kind of like, I don't know, kind of having these jerky movements that are like uncontrolled, that you're not doing it on purpose. Some people have this just normally. There can be many different causes for this. Some people are just born with it. That's what congenital means. That's just like something you're born with. Being under the influence of alcohol can cause nystagmus. I don't know if you've ever seen a cop perform one of those like tests where they pull someone over and kind of do these various things that they have you do to see if you're under the influence, if they don't have like a breathalyzer. They might have you stand on one leg or
a backflip.
Sometimes they do one of those tests where they ask you to watch their finger, and they like have you follow your finger with their eyes, and they're testing for nystagmus, right, to see if you have any of those jerky involuntary muscle eye movements, because that can be an indicator that you're under the influence of alcohol. Certain medications can cause that. Some brain problems, so like neuro issues. So it's kind of hard to like say exactly what the cause is, because it could be from various different things. But yeah, that's what it is, just those repetitive movements of the eye that are kind of jerky, twitchy movements. Diagnosis, you just see it happen, so observation. And then the treatment for it, it kind of just depends on what's causing it, right? So there's not like a one-size-fits-all answer here. It kind of just depends why. If it's alcohol, then obviously gets don't have it anymore. So kind of. There's also something called the Kestenbaum procedure. This one they typically do more like if it's congenital, like if you're born with it, like there's not like an underlying cause as to why it's happening. It's just something that you have, and it's just a surgical procedure that they do something to the muscles to keep them from doing that, to keep them from having those involuntary twitches. All right. Then there's strabismus. This one we typically call like cross-eyed or lazy eye. You've probably heard of those. So basically what strabismus is like that both of the eyes fail to look in the same direction at the same time. So you might have one eye looking off the other one way. So the three different types, there's amblyopia, esotropia, and exotropia. So amblyopia is the one that where it's the lazy eye, right? You like one of the eyes just kind of doesn't focus well, just like you have one eye that does focus and the other one just kind of goes off. Esotropia, that's the cross-eyed where both eyes are coming inward. And then exotropia, where the eyes are turned outwards. Symptoms, so diplopia, this just means seeing double, okay? So you can imagine if you don't have both eyes focused on the same thing, that's when you see two, right? So if you have two eyes, or like one eye going this way, one eye going that way, you're gonna see double vision, right? So diplopia is a common symptom amongst any of these. Diagnostic-wise, it kind of just depends, again, why it's happening. Some people are born this way. Some people have something happen due to like a nerve trauma, or some people get kicked in the head real hard if something happened. That's what that means, like if acquired. Like if all of a sudden you develop this and you didn't have it before, there are going to be more tests. But if you're born with it, then you know that it was congenital. You're just born that way. There are things you can do for people that are born with it. It's pretty common for people to be born with like a lazy eye. They can do corrective glasses, or they can do an eye patch. Anybody heard of like a kid wearing an eye patch to correct a lazy eye? Yeah. It's pretty common. What they do is like they'll put the patch on the good eye, right? Not on the lazy eye. They'll put the patch on the good eye, so that forces the lazy eye to have to try and focus, right? So it makes it have to work harder to get stronger. The lazy eye will just continue to be lazy if you can just rely on your strong eye, if that makes sense. So they take away the strong eye and force the lazy eye to work. And then you can usually fix it doing these things up until about 8 years old, when it becomes like fixed, and then you can't fix it that way. You have to do more advanced like surgical procedures or whatever to fix it. Any questions about that one? No? Y'all are kind of quiet today.
Sorry, I was looking at the exotropia thing, and I feel bad for laughing.
It's okay. All right, next one is an ordeolum. You might know it as a sty. They're pretty common. This is what one looks like, one of those little bumps. It can be either on the bottom eyelid or the top eyelid. This is just the picture that I had off Google. They're really common. Basically what's happening is there's just an abscess of an eyelash follicle. So, the eyelashes, they're on the top and the bottom. So one of them gets, clogged up, and that's what happens. Obviously, symptoms, maybe a little bit painful, could be a little swollen, bump with, sometimes it has pus, sometimes it doesn't. Diagnostic, you can just see it, right? You don't have to do any special tests. You can just see that it's there. Treatment-wise, they just tell you to put warm compresses on it. It eventually goes away. This is acute and self-limiting usually. If it's really bad, or if it's like really pussy, they can put, topical antibiotics on it. So yeah, like I said, they're acute and self-limiting. That just means they resolve on their own generally, even without treatment. Then we have a chalazion, which is very similar to a sty, but just a little bit more swollen. So you can see that this is like more like into the tissue and like more like deep, more deep, where this one is more superficial, like kind of on the surface, if that makes sense. So chalazion, this one's actually an occlusion of a meibomian gland, not an eyelash follicle, so that's why it's like up here rather than down here by the eyelashes, okay? There's glands like in your eyelids that secrete different kinds of lubricants and oils and things like that, so one of them got occluded or blocked. Same thing, symptoms, redness and pain. Just looking at it, you can tell what it is. Same kind of treatment, warm compresses, antibiotics if it's not going away. Sometimes it can get really big, and it blocks your vision if it's so swollen you can't open up your eye. And in that case, they might do surgery to just remove it. That way, you can just get it done quicker. These are also self-limiting. It just sometimes can take a little bit longer, a month or two, for it to go away by itself, versus the styes or the hordeolums. Generally, I've seen them go away in like a week or two. So here, this is a kind of blurry picture. Sorry, the quality isn't that great, but you can kind of just see the difference with this one.
Is it safe to pop the stye?
These, I mean, everyone ever is going to always tell you not to pop anything, even pimples. Do I listen to that necessarily? No, but since it's so close to your eye, I would say probably don't, because you don't want to get a really bad infection there. I might still, but I'm not going to say that you should do that, okay? It's kind of like, how some pimples are like, it has a very clear head and it's very easy to pop. Others, they're just kind of like more deep and cystic, and there's not a good way to pop it without it just like really aggravating your skin.
Mm-hmm.
So, I mean, I just use that kind of judgment. Like, does this look like it's easily poppable or not? But technically, no.
Oh.
All right, blepharitis. This is what this looks like. So, kind of just greasy, crusty pus that's kind of like collecting around the eyelashes. So inflammation there. It can be from bacteria. It can be from just being around harsh chemicals, pollutants. Just something is irritating the skin. Okay. Maybe some cosmetics people are using that are irritating. Maybe you're allergic to something, maybe a lotion or whatever. I don't know. Just lots of redness, crusting, and itching around the eyelashes. Again, you can just diagnose it by looking at it, treating it just using warm soapy water. It's just keeping it clean, to get all that stuff off. If it is a bacterial cause, they can do an antibiotic, obviously. Prognosis-wise, they do go away, but for some reason, people who tend to get this, they tend to recur, so they tend to like have it repeatedly, just because maybe they have this because they're sensitive to whatever, they're already having a sensitivity to something, and that's why they have it in the first place, so they're just more likely to keep having issues with it over time. All right, then entropion. This is just where the lower eyelid turns inward. So you can kind of see here how like the eyelashes are supposed to point out, obviously. But in this picture, the eyelashes are kind of poking in. So the eyelashes are kind of touching and maybe scratching and irritating the eyeball. So here's a picture of an older, I can't tell if that's an elderly man or woman, but since it's
mascara on that.
Yeah, you can see how the eyelashes are poking in, right? You can imagine that's very uncomfortable. Feeling that. You ever had an eyelash in your eye, ladies? Like you do your mascara and like an eyelash gets sprayed in your eye. I hate that. It's the worst. Imagine having that all the time, just like one in there. This happens a lot just because they lose elasticity of their skin, and so the eyelid tends to pop in instead of holding its position out. So obviously lots of tearing, like more tear production just because it's constantly being irritated, itching, redness. You can just visualize it to diagnose. To treat it, it's a very minor surgical procedure. They just poop it back out and brace it so that it keeps it from doing that. And it's an important thing to get done. It's not just a cosmetic thing. It's actually pretty important that they do take care of it, just because that constant irritation can damage the cornea and cause eye ulcers, right? If you have something constantly irritating and rubbing on your eye, that's not good, right? So that's why they want to get that dealt with. So that's entropion. I think N like in, pointing in, because the other one is ectropion. So to not get those two confused, entropion is the eyelid is in. So the ectropion is where the lower eyelid is like gapy and pointing out. So see how these eyelids are really droopy down here? It's kind of like if you were to pull, how you can pull your eyelid down like this to like put your eye drops in it, but they're just always very loose instead of being held up. So the problem with this one is that they tend to have really bad like eye dryness because all of this eye is like exposed, right? And the eyelid is supposed to like help keep the eye moist and have, lubricated tears and whatnot. So lots of dry eye, excessive tear production. The other thing is that since their eyelids are down here, when they cry, they tend to have more like, I don't know how to explain this. You have a lacrimal duct right here. I don't know if you can see that, You can look in the mirror too. There's like a little tiny hole right there at the end of your eyelid. It's actually the lacrimal duct, and tears are actually supposed to like be able to flow in there and drain away. But since like the eyelid is so droopy, the tears they can't get in there, so they just kind of collect and pool out. So it's rather than being held in there, it just all falls out. So that's why part of the lubrication is lost. But anyways, so the issue is just excessive dryness, which can cause a corneal ulcer. Right, your mucous membranes are supposed to stay moist. Your eyelids are supposed to stay moist. The inside of your mouth is supposed to stay moist. We kind of talked about this in immune chapter, and we talked about what was it, Sjogren's syndrome, where they had excessive dryness, and so they can get like mouth sores and things because their mouth was just constantly dry. So it's the same idea with the eye this time. You can get like eye ulcers. So no bueno. Okay. Blepharoptosis is like the full name, although I've only ever seen people just call it ptosis. So those are the same thing, but people tend to just use this short term. Ptosis is just a drooping of the eyelid. So you can see here, this eyelid's droopy, right? That's ptosis. Okay. So this is a permanent drooping. Let's just say drooping, not dropping. Sorry. Of the upper eyelid. There's different things that can cause this. So it's kind of, the etiology is going to be different depending on what it is. But cranial nerve 3, remember we talked about the muscles of the eye, like help you look up, down, left, and right. If one of them can sometimes cause ptosis because it's not able to hold itself up. We also talked about myasthenia gravis. I know it feels like forever ago back in the immune chapter. And the drooping eyelid was a symptom, a very common symptom of myasthenia gravis. If you remember, myasthenia gravis was a very severe weakness. It was a neurological problem where the autoantibodies are attacking the brain, right, and stuff. So a lot of weakness happening. So if someone does have ptosis and they don't know why, then doing a testing them for myasthenia gravis is going to be a good thing to do, just because they tend to be linked. This can happen with one eyelid or both, so it can sometimes be one or two. The problem is if sometimes it can get really bad and it can obstruct your vision, like if you're unable to keep your eyelid open, right, that would be bad. You can do surgery to help hold it up better. If it's the case of myasthenia gravis, then they're going to put you on medications that treat the myasthenia gravis symptoms, and then the ptosis should resolve itself. Right, like you shouldn't have to have surgery if it's due to myasthenia gravis and you're on medication, because this is a side effect of myasthenia gravis, and when you treat the myasthenia gravis, it should get better. All right, who's ever had pink eye? I think every person that has children probably has had pink eye because it's just so common in kids. The conjunctiva is the membrane that covers the eyeball. So conjunctivitis is inflammation. They call it pink eye just because your eye gets really pink, red, and swollen. And sometimes they can leak a pussy discharge. That's usually if it's a a bacterial cause. So you can have viral conjunctivitis or you can have bacterial conjunctivitis. Generally, the bacterial is going to be more pussy like that. I know that's kind of gross. Generally, the viral or allergic even is just going to be more clear, more just watery. Okay. Diagnosis again is going to be mostly off a visual exam. Just you can see it and you can tell. And then treatment-wise, they do have antibiotic eye drops if it's bacterial. If it's viral, it's kind of just, well, sorry, you just kind of wait it out. There's not much we can do for viral things. It is extremely contagious. It's acute, which means that it's not a chronic condition. You get it, and it goes away after you treat it.
Benadryl helps. It knocks me out.
They do have eye drops that can help with itching and stuff. You know, they have people have really bad allergies. I use eye drops all the time in the spring for the pollens. You can use those too, just to help with the itchiness and stuff. But it's not actually treating the illness. It's just the symptoms, if that makes sense. All right, this is a very long word. Keratoconjunctivitis, sicca. That's basically just dry eye, okay? In this one, you're not producing enough tears for whatever reason. And again, this is going back to when we talked about the immune, there was a lot of autoimmune, they can attack the mucus secreting membranes. So this isn't always autoimmune, but it could be. Scratchy, burning, redness, blurry vision, just because your eyes are being irritated from being so dry. They do have eye drops and artificial tears that you can use just to correct this. And if you do have this, you'll generally have to do it for a lifelong, right? This isn't like something acute that it goes away in a week. Like if you have constant dry eye syndrome, that's just something that you have, and you have to like do this for life. So this would be a chronic kind of condition. All right, corneal abrasion. I showed you a picture of this with the staining. Remember, they drop the stain in the eyeball. So you can get a corneal abrasion from various things. If you have something stuck in the eye, like if you get a piece of dirt or a piece of sand in your eye and you're like rubbing it and scratching it, that's why they tell you try not to rub it, because you can rub that grain of sand like into your eye and scratch yourself. Trauma, like if you got whacked in the head with something, you can get a corneal abrasion. Obviously, just symptoms is just it hurts a lot and you're just constantly like producing a lot of tears. Your body tries to do that to flush it out, to get that foreign object out of there. They do the diagnosis with that fluorescein stain, right, so they can identify where it is. Sometimes they'll give you antibiotic eye drops just to prevent an infection from occurring, because now you have a scratch into your eye, right? And so now that creates a portal for germs to get in, right? And we don't want that. They might put a dressing over it, like a patch or whatever, to keep it still and to keep anything from getting in there. And it kind of just depends on how bad it is too. It is important to make sure you treat it or like get it seen to make sure it doesn't turn into a corneal ulcer, right? And here's what an abrasion looks like. You can see it's like a little scratch going down the eye. I don't know what happened to this person. Maybe they scratched it or a twig or something hit them in the face. But here's what an ulcer looks like. You can see how like the layer of the cornea is like starting to disintegrate, right? So like that clear stuff here. Can you kind of see that? It's kind of blurry, but this is the best picture I could find. So this is what we don't want to happen for it to turn into, right? So you're making sure that it's taken care of, got seen, okay?
Are they blind?
No, it's just now you have like this huge opening where potential infection, like more serious complications. It could lead to blindness, but I mean, I don't know this person. I can't ask them. But this is just what we want to avoid, right? Corneal ulcers are considered very bad. A lot harder to treat, right, once it gets to this point. Looks kind of like an alien creature, doesn't it? You all good so far? Not too complicated, right? A lot of little stuff, but it's not anything crazy. Most of the stuff you probably already heard of, right? Pink eye, styes, things like that. Cataracts. These are also pretty common. These are very common in the elderly. This is where it's just the lens. Did I say something?
No, I was just like, and my dog, because with the older dogs, they just automatically get like that cloudy.
Yeah, old dog. This is very common in old dogs too.
My dog got it when he was not even a year old yet.
Oh, that's sad.
So he's already blind, pretty much.
Oh no, poor guy. This is just where the lens gets opaque, which just means not transparent, right? Opaque is the opposite of transparent. It's kind of like, I kind of liken it to like when a window or a mirror fogs up and you can't really see through it that well. That's kind of the same idea. Like the lens is kind of foggy. So you can still see through it, but it just makes it difficult to see. Like looking out a foggy window is a lot less clear than a clear window. So like I said, related to aging or also long-term steroid use. We've talked about steroids since day one. I try to kind of drive it down deep so you guys know that like steroids are usually used short-term. We don't like to use them long-term because they just have lots of complications. Okay, because it's constantly suppressing the immune system, right? So that makes you a lot more susceptible to get sick, right? You're just constantly like being immunosuppressed. There's also lots of other complications. This is one of them. Long-term steroid use can cause cataracts. I don't know how or why. You don't need to know how or why either. Just know that it's a thing. So symptoms of this, people don't necessarily know that they're developing cataracts, so they might come and complain to their doctor that like their night vision is getting worse. That's usually the first thing that people notice, is that they can't see as well at night. That colors seem more foggy and clear. The pupils, if you're looking at someone, they start to look more whitish rather than the normal black color. This is what a cataract looks like. Obviously this is a really bad one, but I just wanted to show you like so you can see like this is what normal pupil, and this is kind of like a foggy lens here. And then this is what vision might look like for someone with cataracts, so that you can still see, it just is more blurry and muted, okay? Diagnostic wise, I mean, if it's, you know, like this, you can obviously just look. You don't have to use any crazy diagnostic tools, but you can also catch them early. That's why like regular eye checkups are important. You know, they can just use their ophthalmoscope, look in the eye and see, oh, it's starting to look a little cloudy. Or a slit lamp, you know, it's just where they look more in depth at the structures. Treatment wise, I know a lot of people that have gotten cataract surgery and it's been really great. They call it a phacoemulsification, which is just a fancy word that means that they take like a little tool and they like vibrate really, really fast, break up that cloudy lens into tiny little pieces, and then they kind of suck the pieces out, and then they insert a prosthetic lens. It's kind of like putting glasses in your eyes, kind of. And yeah, a lot of people have really great results with that. So prognosis is really positive. So that's wonderful for us. All right. Now here's a big one. Okay, so this is a really big one. This is very common, especially with like chronic conditions. Okay, so glaucoma is one of the bigger eye issues that you're gonna come across. This one we talk about the blood pressure and liking it to interocular pressure. So this is that pressure issue one. This is where constant pressure from inside the eye is going to eventually damage that optic nerve, cranial nerve 2. Okay, so how that happens is you actually have liquid inside your eye. It's called aqueous humor. Your eyes are constantly producing that stuff because to keep it lubricated and keep it shape. I kind of explained that like the eyeball is kind of like a water balloon, right? The water inside helps it hold its round shape, right? So like if you didn't have enough aqueous humor, it'd be floppy and not like the round shape, right? So, but too much, you don't want your water balloon to explode and pop, right? So aqueous humor is that fluid. Too much can damage that nerve. Lots of risk factors. I don't know if you've talked about diabetes yet in Miss Kelly's class, but it's a big one, right? Diabetes is like a huge thing in medical community. So type 2 diabetes, that's what that is, T2DM. Very factor for glaucoma. Same with obesity and African American descent. Very common, just being on the lookout for those. The problem with glaucoma also is that most people have no idea that they have it, right? Because it's asymptomatic. Like they don't realize anything. They're like, oh, my eyes feel fine. I don't have any issues, so they don't go get checked, right? The problem is that once you start having damage, it's usually already too late and you can't reverse it, right? So that's why screenings are really important. Like they usually start like eye screen. I don't know what age, but once you hit a certain age, they want to start doing like regular eye checkups to make sure that you're not developing like increased ocular pressure and you don't realize, right? Because once the damage is done, right? You can prevent it from getting worse, but you can't restore what's been lost already. So that's the sad part, okay? Diagnostic wise, they usually just do routine tonometry tests where they do that little air puff on your eye to see how much pressure is there. And that's a really good thing to do because, like I said, you might not even realize you have this. Most people don't realize they have high blood pressure either until they get their blood pressure taken. You know, so same idea. Treatment-wise, they have medications. Once you have been diagnosed with glaucoma, they have medications that will actually help to decrease about how much aqueous humor is being produced, which will bring the pressure down. Or they also have medications as well that can help drain the fluid faster. There's also a surgical procedure called a trabeculoplasty. There's little drainage systems in the eyes where the fluid because the fluid's constantly being made and being recycled. Right? It's not that the fluid's there forever. Like they create the fluid, it gets recycled, they create more. It's like this constant system. I kind of think it like a sink. Like they have the sink on, but there's also a drain. Right? And if the drain gets clogged, then your sink is going to back up and fill up, right? So this is basically just fixing the drainage system, the trabeculoplasty, so that the fluid can drain out better. Does that make sense? Mm-hmm. And prognosis-wise, glaucoma is the major cause of blindness here in the U.S. This is a chronic condition. It's going to be constantly managed with medications and eye drops. This isn't something that will go away. And once the damage has been done, it's unfortunately irreversible. So here's just a little bit more about those surgical options. The trabeculoplasty is what I was talking about, like the drainage system, so that it can flow out better. There's also cyclocryotherapy. You should recognize cryo. What is that? Freezing. So what they'll do is if your problem is that you're just producing too much of this fluid, they can actually freeze those cells, the ciliary bodies. Those are what actually produce the fluid, the aqueous humor. They can freeze those and kill those off so that you won't produce as much. They won't obviously do it to all of them because then you won't be making any aqueous humor, but they'll do it to some of them so that you just won't produce as much. And then there's also an iridotomy. This is talking about the iris, iris. So they'll just put openings in the iris to help with the draining as well. You don't need to know like all the details about like what these are and how it's done. Just being able to recognize trabeculoplasty is for glaucoma. Cyclocryotherapy, this is just the basics, right? Be able to recognize what disease this is for. Does that make sense? I don't expect you guys to know like how to do the surgery or all the complications or anything like that. Here's what someone's vision will look like with glaucoma. So like this is obviously normal. Here's like early symptoms. So you can see why maybe someone might not notice this because it's like very subtle, just kind of like you're starting to slowly lose the edges of your vision, like the periphery, right? And you might not notice that until it gets like here. And it's like, oh wait, I can barely see my peripherals anymore. But once it gets to that point, you can't get it back. Okay, so that's why, again, they stress regular checkups. All right. This might look overwhelming at first. I promise it's not. This is really the only eye condition that really has specific medications. So there's not going to be a bunch of slides at the end about medications. There are obviously a lot more medications for glaucoma, but I just focused on the main two. So there's two categories. There's prostaglandin agonists and beta blockers. These are just the drug classes, okay? And I remember I talked about how some of them help decrease the production of the fluid. That's what these do. And then these are gonna help the fluid to drain out better, increasing the outflow. You'll notice that all of these end with prost, which is helpful because it's prostaglandin agonist, so it's in the word, that's easy to remember. And then these all end in what? Beta blockers from producing as much fluid to help bring the pressure down in the eye. And these are going to be in like eye drop form, okay, generally. This one is also like a loss of vision issue, generally related to aging. So this is common, this is a very common cause of blindness in the elderly, where you start to have deterioration of the macula. The macula is the part of the retina where you have your central vision. So glaucoma, you start losing your peripheral vision. With macular degeneration, you're losing your central vision. So that's what you'll start to lose, which is very inconvenient because it's hard to look at things when you can't see straight on, right? So like here is an example, where to go, of what macular degeneration affects. So obviously that's a lot more annoying. So you have to kind of dry. You don't need to know a ton about those are, just that the wet form involves weakened. Right? So wet macular degeneration is caused because those vessels in the back of the eye are having leakage and hemorrhages, right? So it's bleeding and that's just what's causing the problem. Whereas dry is related to aging. That's all you really need to know. They diagnosed this with fluorescein angiography. Okay, so remember they put the dye into the bloodstream and then they're able to, it makes the blood vessels pop up when they look, just so they can see exactly where the blood vessels go, and then they can see if the vessels are leaking, so diagnose the wet or whatever. They also can see what's called drusen deposits. That's very interesting and random. You can see these little yellow speckles. Those are called drusen, and that is very diagnostic of macular degeneration. You don't need to know anything else beyond that, but just be able to recognize that that is related to macular degeneration. Okay, so if you see that pop up in like a diagnostic finding, you'll know what they're talking about. The drusen is related to that. Treatment-wise, there's a bunch of different laser therapies they can do to kind of help that. A common thing you might injection, it's a long word, which basically blood vessels from growing. Because what's happening is, here for example, you can see the blood vessels and you can see how they're leaking and oozing. Really what they're going to do, those injections will stop the vessels from being so weak that they burst, okay? So that's all that matters with that. Unfortunately, there is no cure for macular degeneration. They can do lots of different treatments like these to try and help prevent stuff and manage it, but there isn't like a button you can push to cure it. It's not something that resolves. It's kind of a chronic condition that will continue to progress unless you're constantly staying on top of it with medications and treatments. Okay. Any questions about this one? Oh, I forgot one more thing. There's also a Amsler grid that they use. An Amsler grid is basically they'll take one of these like charts, and this is not what it looks like. This is what it looks like to someone with macular degeneration, right? They'll start seeing wavy and blurred, distorted lines in the middle where it's actually straight, right? Like this does not actually look like that. That's like the vision of someone with macular degeneration. So they'll hold up a little grid and ask them like, are the lines wavy or straight in the middle? And they'll tell you straight, and then cool. Or they'll say, hey, they're really wavy in the middle. It's like, that's macular degeneration, okay? So that's an Amsler grid. All right, here's another big one. Again, because it's related to diabetes. Diabetes is going to be something that you guys deal with in medical coding all the time. Because diabetes is really big, it's really prevalent, it also causes a lot of other problems, right? So it's not just an isolated illness, it impacts the whole body, like the eyes, for example. So diabetic retinopathy, this one is because diabetes causes poor circulation, not just in the eyes, but everywhere. You probably know someone that maybe has had an amputation in their foot and they have diabetes, maybe. So poor circulation is a very common thing in diabetics. So that relates to the eye as well. So since there is poor circulation, the body tries to compensate for that by producing more blood vessels to try and get more blood flow to an area. They call that neovascularization. Okay, neo meaning new, right? And then the problem is that when they're rapidly trying to create all these new blood vessels, they're actually very weak and